Hi guys, it's X. Welcome back to my channel. In today's video, we are going to be talking about migraines and headaches, and I recently thought of this video because I suffered a concussion that led to a migraine that was non-relentless, and I just wanted to talk about my personal experiences with headaches and migraines, and hopefully it can help someone out there. And if you are a nursing student or a nurse that follows me specifically for my nursing videos, I just want to apologize because I know I focus on many different things, whether it's fitness, skincare, makeup, and stuff on this channel, but this video is specifically for you. So if you want to know what I have to say about migraines, my experiences, just keep on watching. Don't forget, before you swipe me away or click me on this video, please like, comment, and don't forget to hit the subscribe button. Thank you. I apologize in advance for the air conditioner, but it's too hot for me to turn it off, so just bear with me. But I've suffered from headaches for a very long time. Background history of mine is when I was 18 years old, I got into a major car accident that gave me TMJ, and for the longest time, I thought my headaches were stemmed from there. There are three types of headaches. There's cluster headaches, migraines, and tension headaches. I suffered from tension headaches for a very long time. I used to go, I want to say from the time I was around 2021, through a bottle of Advil, and I mean the little 24 bottle of Advil, one every month and a half. I used to have headaches all the time. Headaches actually dictated my life. I literally would plan my life around if I was gonna have a headache, whether I slept too much or too little. I was always in fear of having a headache. I wouldn't want to go out with my friends because I was so scared that I would get a headache. These headaches used to ruin my life. And there's one thing that I wish I would have paid attention to, is that one time I went to go see my nurse practitioner because she's my primary care provider. And she was doing my yearly physical exam, and she said, "Oh, you have really bad allergies." And I was like, "No, I don't. What are you talking about? You're crazy." Like, no, I don't. And I wish I would have listened to her, because ever since I started taking care of my allergy symptoms, my life has completely changed. And I didn't really pay attention to that until another nurse practitioner on Instagram actually recommended this. So here's what happened. When I went for my yearly physical, she looked at the color of my mucosa and she said, "You have really bad allergies. The color of your mucosa from your nose is consistent with someone who has really bad allergies." I never realized that I didn't breathe well, because I've had cats my whole life, pets my whole life. I've hiked, I bike, like I do so many outdoor activities, and I've never had itchy, watery eyes, stuffy nose, those allergy symptoms that usually people have. So I ignored it. I just thought she was crazy because I've never suffered from those symptoms. What I didn't realize is that my turbinates are constantly inflamed, and I was just so used to breathing that way that I just never put two and two together. I always assumed because I got in that really bad accident, my TMJ, like that's kind of when my headaches started. So this nurse practitioner that I was following on Instagram said that she used to have headaches all the time until she started taking Flonase, the spray. And I was like, that seems like a load of crap, but let me try it. Well, I started taking Flonase, one puff per nostril daily. It literally changed my life. I also started Zyrtec daily, and they recommended Loratadine because I started getting GERD and I thought I had a postnasal drip, so I started taking care of that, and the amount of headaches that I get significantly has changed. It no longer runs my life. However, I was diagnosed with migraines in, I want to say, 2016. The first time I ever had a migraine, I thought I was having a mini stroke known as a trans-ischemic attack. I thought I was having several of these, and it was very scary. I was a nursing student. I still wasn't seasoned as a nurse. Like, I was still in school, and I was terrified. So here's what happened. I thought when you had a migraine, you had it for a day and that's it. I didn't know the symptoms, the auras, and all that can actually last longer than the headache. So I had a headache, and I never really realized that these were migraines because I didn't start getting auras right away. So one day I was nauseous, like the headache, I'm in pain for like 8 hours. It's miserable, right? Like no matter how much Advil, like the recommended dosage, it just wouldn't go away. The nausea is terrible. I feel like the nausea made it 10 times worse. So one day when I met my husband, I was in nursing school. My husband was in the medical field, but he was like, you need to really go get a CAT scan or something. Like it is not normal for somebody to have this many headaches. So finally, one day I couldn't take it anymore. I had this headache that was just so horrible, and here's the symptoms that I had with it. Now when I get migraines, I always get these auras, and what an aura is, and just a disclaimer, if you get migraines with auras, you're at a high risk for stroke. So if you're in that category with me, I'm sorry. But basically, the aura that I always get is squiggly lines in my vision. So it kind of looks like the TV when it's black and white and it has all those like little black dots. It's kind of what it looks like. So I'll always get a squiggly. I see it in both eyes. I see it over one part of my vision, or I'll get like a total peripheral vision loss. That is like really, really scary, especially if you don't know what that is. But other symptoms that I was also getting that were lasting longer than the actual headache was, besides the nausea, I was having expressive aphasia. And what expressive aphasia is like you're trying to communicate the right word, but you cannot. So I worked at Starbucks for a decade when this was happening, and I had customers that I've known since I was like 17 years old. I was now 27, and I couldn't remember their names. I was saying weird things like, do you want whipped cream with your bagel instead of cream cheese? Like it was really odd. People's faces that I would know, that I've seen every single day of my career at Starbucks, like I couldn't pinpoint their name, and I was very discombobulated. I would bump into things. I would I would walk and like hit the corner of things, and those were the symptoms that were very scary to me, and what made me feel like, am I having a stroke? Like at this point I really didn't know what a stroke was, like, but I was like, this is so scary. Like, how am I fumbling my words? How am I discombobulated? How am I bumping into things? Like, why am I super nauseous? Like, confusion, very, very confused. And to this day, every time I get a migraine, those symptoms last way longer than the actual headache. Sometimes it is those symptoms that bother me more than the actual headache, and seeing the squiggly lines, because the squiggly lines are miserable. Like, they don't just go away. What changed my life was the medication that I was put on. So everybody's body is different. So before you go and ask your doctor or try medicine, here's the things that I want to talk about and emphasize on. So I was started on sumatriptan. Sumatriptan, or Imitrex, didn't do shit for me. I was taking only 50 milligrams. I believe you could take up to 100 in one single dosage. So I was taking sumatriptan, but you're supposed to take it on the onset of the headache, and it didn't work. I didn't really feel a difference, and the sucky part is that headaches are kind of managed by a diary. They're always going to ask you, like, write a diary. They're going to tell you to stay away from chocolate, caffeine. What are your triggers? Some people are very sensitive to light and sound. I'm thankful that I'm not sensitive to those things, but those are other symptoms that people can have. And so at this point, like every time I knew once I would see the auras, I would just drive straight to urgent care, because I already knew that the next 8 hours of my life were going to be miserable. And I felt like almost like a drug addict, because I would literally like rock back and forth and like like just moan and groan and like want to throw up but couldn't throw up. Like the nausea is terrible. And so every time I would go to urgent care, usually what they would give me is Reglan, Benadryl, a liter of fluid, and my life-saving medication is rizatriptan. Actually, let me double look and make sure that I'm pronouncing that right, because it is similar to sumatriptan and Imitrex, but it is an ODT, and it has changed my life. So basically, on the onset of symptoms, when I start getting these little squigglies, I would put it under my tongue, let it dissolve, and within an hour, the symptoms are gone. I would take Advil with it, and it would just help me so much. But recently I had a scare and I should have known better. So this is what actually motivated me to make this video. I apologize for my dog. I went to the beach by myself. I'm very adventurous. I love to hike, bike, swim, and because of my work schedule, it just doesn't really coordinate with any of my friends. So I just got used to kind of doing a lot of these activities by myself. So I went to the beach one day, it was like a couple weeks ago. I've been itching to swim, you guys. Like, I love swimming. Swimming has always been calming, like therapeutic for me. So I go to the ocean, and I should have known because when I got to the beach, they were rescuing somebody, and I was like looking because I see all the lifeguards running, and like I'm a nurse. I'm really good at CPR in my opinion. So like I love doing CPR. So I was like, if somebody needs help, like I'm there to help them. So I see that they're rescuing somebody, but I'm like, don't pay attention too much to it. I'm by myself, but there's a lot of people on the beach. So I go into the water and I'm swimming, and I think God was sending me signs, but I just was not paying attention to them. So I'm swimming in the ocean, and I consider myself a pretty good swimmer. I haven't swum in a really long time, but I used to competitive swim in high school. So I'm swimming and I see this really big thing that looks like a shark. So I like swim out and I realize it's just seaweed. So I go back in the water. It's my first sign. I go back in the water and I'm swimming again. This time I see a fin. So I haul my ass out of the ocean and I see it's just dolphins. So here I go back into the water, and I have these really big goggles on that we got in Hawaii because we were snorkeling in Hawaii the last time my husband and I went on a trip. And I have these big goggles on. That's like my favorite thing to do. My favorite thing to do is swim into the wave and like look at the bottom of the ocean and like find the buried treasures, right? Like seashells and stuff like that. So here I go. I'm literally vertical in the water and I run out of breath. So I swim up, but I'm swimming at an angle now. So now the waves are coming this way and like my temple is facing the wave. I got knocked out by that wave so hard. I've never been hit that hard in my life. I got hit so hard that I immediately hit the ocean. My goggles fly off, and I mean, these are pretty big chunky goggles. They fly off me and I'm like sad. I roll 3 times on the bottom of the ocean floor. Luckily I was able to catch a breath, but I was like, I at this point accepted that I was gonna die because I was like, there's no way I'm going to survive this if I don't get another breath. Like if another wave hits me, I'm exhausted at this point. Like I realized quickly I wasn't as strong of a swimmer as I thought. When I got out of the water, if you guys don't know what nystagmus is, it's basically when your eyes kind of shift back and forth, side to side really, really quickly. I could see literally this. Like I wasn't dizzy or like the world wasn't spinning at this point. My vision is going back and forth like this. I am nauseous. I'm discombobulated. My hands are swinging this way. I'm trying to step one step forward to try to get out of the water. And I have to sit down for a second, and I was like, I have a concussion. I'm 100% sure I have a concussion. Like I'm dizzy, I don't feel well, I'm discombobulated. Like I got knocked out. I was so lucky that I didn't lose consciousness because I don't know anyone at this beach. Like thankfully there was lifeguards there on this day. So I sit down for a half hour. Me being a nurse, I was like, okay, if I throw up, I'm going to the ER. If not, I'll just keep checking my pupil size, like looking in the mirror, making sure that I'm fine because I was scared, like what if I have a head bleed or something? I felt fine enough after a half hour. I waited, I just sat there at the beach by myself, like waiting to feel better. And once I felt strong enough to drive home, I drove home. And I kept checking my pupils throughout the day, but then I started freaking out because I started feeling like numbing and tingling in this elbow, and I was like, oh, shit, should I go to the ER? And me being stubborn, I was like, I don't want to go to the ER because I don't want to pay all that money. Like urgent care is not going to do anything. Like I'll just keep an eye on my symptoms. Next day I was okay, and then I wake up for work this happened on a Wednesday morning, I believe. I wake up for work on Sunday and I feel totally fine. I'm great. Like I go shower, I'm doing my makeup, and it's 5:45. The latest I could call out sick is 5. I live an hour away from my job. So I'm doing my makeup at 5:45 and I just feel this weird sensation on the side of my face. And I'm like, I think I'm getting a migraine. Am I getting a migraine? No, this isn't one of my typical migraine symptoms. But I just trust my judgment and I go and I take my rizatriptan. And so I take it, usually goes away in an hour. So I'm driving and I lose my total peripheral vision on my right eye. And I'm like, oh, great. Like, I already know where this ends. So I go to work. I call work on my way and I'm like, I'm letting you know that obviously I can't call it sick at this point, but like I'm coming. But hopefully my symptoms will resolve by the time I get to work. By the time I get to work, my peripheral vision is back, but I'm like in that moaning weird, like I can't control it. It's really strange how to explain it. Like I'm just in this moaning, like, ugh, like I feel like I'm gonna throw up, but I can't. And so I get to work and I lose my peripheral vision again. I see the wigglies and I'm like, okay, this is scary now because I don't ever have these symptoms come back. I've never had them come back. Once I take my medicine, it kind of is like done deal. It's over. Like it doesn't come back. And this day it was really scary. I had to go to the ER. I ended up leaving work and the doctor was like, yeah, sounds like you got a concussion and it triggered your migraine. So here we are talking about migraines. I'm going to read you this from my lecture. So there are 4 phases of migraine. The premonitory phase, characterized by symptoms which precede the onset of a migraine. Symptoms may occur hours to days before migraine, include fatigue, irritability, loss of concentration, stiff neck, and food cravings. Personally, I get fatigue, irritability, and loss of concentration. Then there's your migraine aura, which is characterized by symptoms that affect your vision, senses, motor skills. No focal neurologic deficits noted with these symptoms. Well, let me tell you, with my auras, feel very like the vision is definitely something that affects me. Then there's a headache phase, which is characterized by throbbing pain, starts on one side of the head, may spread. That totally happened to me. My migraine started here and then it like shifted to this side. It says pain may be associated with fatigue, nausea, vomiting, dizziness. Symptoms last 4 to 72 hours. I've had them last about 5 days and it is the worst, especially when you sound retarded because you can't figure out what word you are trying to say. The next part in my this was when I was in school is for my lecture is recovery phase, marked by irritability, fatigue, depression, may take days to resolve. This is so funny because this is why I'm so glad I always review these things when I speak about them, because I didn't know that you can have depressive symptoms. And I literally remember telling my friend at work and my husband, like, I feel really depressed. I feel really sad. Like after my concussion, I was so depressed and there was like no reason. I didn't even know why. I like literally just felt depressed and had no reason why I felt that way other than the fact that I knew I just had a migraine. Okay, so as I said, when you are first diagnosed with either headaches or migraines, what they're going to ask you to do is keep a diary, a food diary, what time of the day you're getting these headaches. And why I'm laughing right now is because I work with this doctor that I love so much, and we were both like, when the Apple 7 watch was coming out, we were both talking about who's gonna get the better watch, right? And so I'm very into fitness. And so we were talking about the rings. I was like, why don't you close your rings? And I have all my health data filled out in my phone, in my Apple phone, because you just never know when something bad's gonna happen. And you know, you can push the emergency and it gives you like all your information. And one of them is headache. And he was laughing at me and he's like, why do you have this useless information? Like, what are you gonna do with that? And I was like, hey, in the primary care setting, we work in the ICU. So in the primary care setting, first thing they're gonna ask you is to have a diary of what you eat. So unfortunately, migraines increase the risk for epilepsy, depression, anxiety disorders, cardiovascular disease, and stroke. They're usually precipitated by altered sleep patterns, skipping meals, overexertion, weather changes, dehydration. Make sure mine are triggered specifically by stress. Unfortunately, except for this last one, well, I guess getting knocked out on concussion or from my concussion was a pretty stressful situation. Hormonal changes, bright lights, strong smells, alcohol, or the use of nitrates. And of course, migraines are not always understood. So funny because everybody's migraines are so different. I want to say they are predominantly in women and they usually are diagnosed around the ages of 30. Sorry, I know I just said migraines usually start as early as, sorry, in your 30s, but what I meant was it can start in adolescence and around age 30. Next thing I want to talk about is really big prevention. So I think once you find your triggering factors, one thing that I find is funny is they're like, stay away from caffeine. And I find that kind of funny because the Excedrin migraine medicine has caffeine in it. So to me, I don't think caffeine, I only drink tea, I don't drink coffee, is something that helps me. Like I don't think it is a trigger for me. I definitely, for my personal self, know that stress is a really big trigger. Everybody's body is very different. This is not something that you read in a book and know, like, these are the symptoms, this is what's causing it, you need to rule out this, and this, because everyone is so different. Like, I know people who are very sensitive to light and sound. That is not me. I don't care about the bright lights or sound. Like me, it's more nausea. I don't really vomit, but like that is probably the worst symptom that I have besides the aura. Okay, so there's different medications that you can take, whether you take aspirin or NSAIDs. There's preventative medications that you can take as well. Your doctor can prescribe you. The first thing I was ever put on was amlodipine, and it's a blood pressure medication. So typically people are put on some type of beta blocker or calcium channel blocker to prevent the migraine. To be honest, I hated being on amlodipine. I was on the lowest dose. I was taking 2.5 milligrams a day. I felt like I wasn't in my body, and I know that sounds weird, but it is the weirdest thing to describe, but that is really how I feel. I felt like I was in my body, but like at the back of my brain looking out. I felt like when I would grip things, I would be trying to grip it as hard as I can, and I couldn't feel it. Like, it was just the weirdest sensation. So to be honest, I hated being on amlodipine, and I actually spoke to my doctor and got off of it because I didn't like it. To be honest, controlling my sinuses and my rizatriptan has just changed my life. Like, it is so much better. I now get a migraine once every 6 months, but I know there's people that live with chronic migraines. There's also something called a rebound headache. Basically, when you take Advil, it rebounds and you'll probably get a headache the next day, which is even more horrible. So, sorry, someone's trying to FaceTime me. I was looking at it. Also, there are other things that you can do. I think one of the most extreme measures is that you can get Botox injections. I know my sister-in-law gets 23 injections of Botox. There is also a piercing that you can get here. I believe it's the tragus piercing, or I don't know if they call it, no, they don't call it the Monroe. I don't know what this is. This is referring to Monroe. But I've heard some people get a piercing here and say that that helped and that worked wonders for them. I personally have not. I just can't sleep with earrings, so I would not get that. But I know that that is something that is an alternative. Let me see, what other medications can I think of? Sorry, I'm reading on my reference notes to make sure I cover everything, but I already expressed that things that can trigger it are stress, anxiety, depression, frustration, foods. So this is kind of funny to me. Tyramine, such as cheese, aged cheese, nitrates, those obviously cause headache because they vasodilate. So like, we know those are going to cause headaches. Phenethylamine, which is in chocolate, monosodium gluconate. You guys, glutamate, MSG, whatever. I find this kind of funny and odd because there was a period of time where I would always go eat pho. I used to eat pho once a week, and then I don't know why my body, like, I love pho to this day. I don't eat it as much as I used to, but there was a point in time where I had to stop eating pho for a while because every time I would eat it, I would feel sick. I'd get a headache, and it was crazy. And then another thing that I want to talk about, which kind of makes me laugh, is aspartame, artificial sweeteners. People laugh when I'm at work, but I literally cannot have Sweet and Low, Splenda, or like the Equal. It makes me neurologically crazy. It sounds funny, but it really does. So it gives me like a headache, but not like a really painful headache, more like a bothersome headache. But the other symptoms of like not feeling in my body, feeling woozy and dizzy is like what I think trips me out, which sucks because I love iced tea. Black iced tea with sweet and low I think tastes amazing, but I have to be at home and willing to suffer the consequences because it really makes me feel like shit. Okay, so other things that you can avoid is drugs, alcohol, caffeine, things like that. But anyway, thank you guys so much for watching this video. I hope it's informative for you. I hope you get in figure out what is causing and triggering your migraines, because I know they are the worst, at least for me. Every time I have a patient that tells me I have migraines, I'm like, oh, I feel you, because it is the worst thing ever. So don't forget, if you are a nurse, to please go and look things up for yourself. Every hospital has different treatments. Every primary care physician has a treatment that they like better than the other, and there's always new things coming out. So I don't know when you're watching this video, but there are always new practices and journals and things like that with new evidence-based practice. So make sure you do your own research, and if you are a patient and you are watching this, make sure you do your diary, talk to your primary care physician. Not every medication is going to work for you. Just because it works for me doesn't mean it's going to work for you. Funny thing is, me and my coworker actually do use the same type of medication, and somebody that we were working with was suffering, and we were like, we have migraine medicine if you would like some. Gave it to her. She threw up everywhere. So you just never know how things are going to affect your body. But the reason why is because she didn't take it on the onset. She took it during the middle. So actually it's what she's prescribed now. So she says it works wonders for her now, but at the time she just took it at the wrong point of the headache and it was too much for her. I really think she threw up because it was a migraine, not really because of the medicine, but you just never know. Everybody's body is very different. Well, thank you guys for joining me on this video, and I will see you next time. Bye.